Hi, I'm Bill Bateman and I'm a shared care GP. After graduating from Melbourne University Med School, I worked overseas doing some extra training in obstetrics and paediatrics, and then I worked for over 20 years in rural general practice where I delivered 800 babies. In my metropolitan practice, I still mostly treat young families, and that's what I'm here to talk about today. The first 3 months of a baby's life can be very challenging. It's a magic and wonderful time as well, but it can have its challenges too. I'm sure lots of new parents out there have had the experience of standing in front of that big hospital, midwife's gone back inside, partner's gone to get the car with the new baby capsule in it, and you have this sudden panicky feeling. How do they know that I'm able to look after this baby? And where's the user manual for this baby? And so basically you have to write that user manual yourself. But the good news is there's lots of people that can help you. So my first thoughts that for that first 3 months are that, especially for the new mother, you've really got to look after yourself. You've got to be selfish. You've got to make sure your partner takes as much time off as possible, and you've got to call in any favours from parents and family and friends, and don't be too proud to ask for help. If people come round to visit, don't be making them cups of tea or coffee. Get them to run errands for you or to sit with the baby while you have a nice, long, hot shower. Luxury. So your baby will have its first contact with the doctor after leaving hospital, usually at about 6 or 8 weeks for the 6-week check. But of course you can bring the baby in any time. If you've got any concerns after you get home and leading up to that 6 or 8 week time about either you or the baby, just come on down. So find yourself a doctor who's got some experience with young children, and word of mouth is good, so ask around. The other person you will have met by now is your maternal and child health nurse, your other new best friend. So as far as the important things that I see a lot with young babies in this time, so what should you have in your medicine cabinet now that you've got this new baby in the house? The good news is not much. Good to have some baby Panadol or paracetamol. Panadol can help bring down fever and is also good for pain and is appropriate for babies over 1 month of age. Nurofen or ibuprofen can also be used for the same purpose, but shouldn't be given to babies under 3 months. It's also an anti-inflammatory, so it can be a little bit hard on the digestive system, so it's always good to give it with a feed or some sort of food. Should never give young children or babies aspirin. And of course, Panadol and Nurofen can bring down temperatures and make babies feel a bit better, but they don't actually treat the cause of whatever is going on. So if there is something that you need to get checked out, make sure you do. Other things which are useful to have are saline drops in case the baby gets a blocked nose, and you can get these vacuum type suction devices for help getting really stubborn boogies out of babies' noses. Not that babies really enjoy that procedure much. And you can use a vaporizer, you can use rubs for the chest and for the singlet to also help unblock the plumbing. If your baby ends up having to take antibiotics, then sometimes it's good for the baby to have probiotics as well. Next thing, when should you seek medical advice? A big take-home message is, if you're starting to think that maybe you need to seek some medical advice about your baby, well then you definitely do. You're the expert in this baby, you know this baby better than anyone else. And if you think maybe the baby's not so well, you don't want to sit at home wondering about that, you want to get that checked out. And if you go and see your doctor, or if you take your baby to the Royal Children's Hospital and it turns out that the baby is fine, that's actually a good outcome. That's a win-win. So don't hesitate. The sort of things that would make you think that you should take the baby in is really just a change in the baby's behaviour. So if the baby seems to be reluctant to feed, seems to be a bit flat and floppy, having breathing difficulties like breathing particularly quickly, lots of vomiting, unusual sort of rash, or a fever that persists more than a day or two, these things all need checking out. And getting back to this 3-month thing, the bottom line is that if you've got a baby less than 3 months old with a temperature of over 38, that baby needs to be seen by a doctor. The next thing I'd talk about would be basically the kind of problems that we see with young babies from sort of head to toe. And a common thing we see is sticky eyes. And that comes in a few different varieties. Some babies just have a watery eye or 2 watery eyes. Usually means they've got a partially blocked tear duct, which is harmless And the best thing to do is to massage that baby's tear duct, which is right here, which you can do while you're feeding. And in rare cases, if the tear duct doesn't unblock by about a year or so, sometimes babies have to have that tear duct probe to unblock it. Second thing is babies' eyes can get a bit gunky, and that can be just due to the blocked tear duct too, but it can also be due to viral conjunctivitis, usually part of a cold. And that sort of conjunctivitis is really contagious, just by direct touch. So it just means that when you touch your baby's eyes, just be very careful to wash your hands, because we all touch our eyes a lot. The thing you can do for viral conjunctivitis is to use a little bit of breast milk, and also just make sure you're cleaning the gunk away. If babies get a really persistent pussy sort of discharge from their eyes, green and yellow, kind of fluoro, that usually means it's a bacterial sort of conjunctivitis, and that baby might need antibiotic eye drops. Another thing which babies often get, which we see, is tongue tie. So the baby's tongue seems to be, if babies aren't able to protrude their tongue over their lower gums, or if they don't seem to have very much movement from side to side, and the tongue seems to be a little bit anchored by the membrane underneath, that can sometimes cause troubles with feeding, especially in breastfed babies, and sometimes babies need to get that snipped. Some babies develop a bit of a flattening on one side of the back of the head, and that is often something about the position that they were in the uterus, and also the fact that we nurse babies usually these days lying on their backs. That's very common, and often it's simply a matter of just some stretching and encouraging the baby to turn towards the affected side by placing the baby's cot, so that when you come into the room, the baby looks around in that other direction. Sometimes it can be worse than that, and other forms of treatment can be necessary. Teething, of course this doesn't happen at 3 months. Most babies are teething by 6 months, however, and the impact of that varies from nothing, just the arrival of some teeth, all the way through to low-grade fever, lots of drooling, fingers in the mouth, getting a bit rashy, getting a bit cranky, and sometimes some loose bowel actions. And of course you can treat teething with Panadol, and you can use things like Bonjela. And lots of people use these amber bead necklaces, which many parents claim helps as well. Moving further down the body, belly button. So the belly button, the umbilicus, the cord usually separates by about 10 days, can get a little bit mucky in the meantime, but that's not usually a problem. It's only really a concern if the baby gets an area of redness emanating away from the belly button in the skin around it, often in a triangular diamond sort of shape, and that's certainly something to check out. Next thing is hips. Some babies can be born with clicky hips, and also sometimes with a bit of asymmetry of their thigh creases, either at the front or at the back. Sometimes that means that the baby has got a hip problem, and you'll find that the maternal and child health nurse or the doctor will be fairly keen to get the baby to have an ultrasound scan of their hips if that's the case. Usually the ultrasound scan is normal, but it's always worth getting that checked out. Nappy rash. Lots of babies get nappy rashes. No surprise there. It's just really a form of contact dermatitis. And when you think of what goes on underneath a baby's nappy, it's not surprising. It's a bit like a wet suit effect. There's a bit of occlusion from the nappy, it's warm and it's moist, and the skin is in contact with lots of wee and poo. So they get this contact dermatitis. And the way to deal with that is usually to use disposable nappies, frequent changing, a bit of nappy free time if it's practical. Often it's not that practical. And using barrier creams, and of course using non-irritant baby wipes. And sometimes babies can get secondary infections in the nappy area, usually a fungal infection which needs to be treated by antifungal cream. Baby boys of course have some unique problems in that area. They can get swellings in their scrotum, which can sometimes be due to a hernia, can sometimes be due to a little bit of fluid around one of their testicles, and it can be something that does need checking out on occasions. Babies can get swellings in their groin, which can sometimes also be due to hernias, and they need to be checked out. Back to the umbilicus, babies can get umbilical hernias too, so they can get a swelling, a big time outie from their belly button, Unlike the groin hernias, those things don't tend to get obstructed, so they're not really much of a problem apart from being a bit of an aesthetic issue. And if that persists when the baby's older, then sometimes babies get those repaired. Pooing. So the frequency of babies pooing varies tremendously. And you will have gathered from what I've been saying so far that when it comes to pregnancy and childbirth and babies, the golden rule is that there's no golden rules. So some breastfed babies will have a dirty nappy after every feed, and some of them will have a dirty nappy about once a week. So what's normal for one is not normal for another. It's only a problem if a baby doesn't do many bowel actions, if it seems to worry the baby. So if the baby seems to be getting very farty and red in the face and straining and just producing some little pellets, then that's something to do something about. Also, if there's a big change in the baby's bowel habit, or if the baby starts getting some mucus or some blood in their stool, then that's something you need to chase up as well. As far as wet nappies are concerned, of course we expect babies to have 6 or 8 or so a day, pretty heavy wet nappies, and if they're not producing as many wet nappies, then we get a bit concerned about the baby in terms of the baby's hydration, and maybe that needs to be looked into as well. So the only other thing I'd comment on that relates to all of that is immunisations. Basically, we recommend that babies usually have their first immunisation at about the 8-week mark. Then they have another one at about 4 months, another one at 6 months, another one at 12 months, and then 18 months and so forth. That first vaccination, it consists of some oral medication called Rototec, and then 2 shots in both outer thighs. There's another medication or another vaccination that we recommend which is not on the schedule, which means it's not paid for by the government, which is called meningococcal B or Bexsero, which is for an illness which is not very frequent but is a nasty illness. And so that vaccine is available. In many other countries it is on the schedule, and despite the cost, we do recommend it. We also recommend that during the flu season that babies from 6 months on should have flu vaccine. So that's vaccinations. Now, the other thing I should go on to now is really the biggie. It's the elephant in the room. The commonest problems we see with babies in the first 6 or 8 weeks or so are babies that cry a lot, unsettled babies. And of course, babies are unsettled by nature. Babies do cry a lot. It's what babies do. And of course, lots of babies get what we generally call colic, even though no one really knows what that means. But suffice to say, most babies cry up to about 4 hours a day. Some babies cry more than that. They often get red in the face. They often arch their back and pull up their legs, and it looks like they're in lots of pain. But most of the time they're not. And those babies, that kind of crying peaks at around 6 or 8 weeks, and it tends to be mostly in the evenings, and it tends to go away round about 12 weeks. But of course that can be a pretty long 12 weeks. But it's important when you're dealing with a baby with that sort of problem to try to be calm, to use a baby-centred type approach, and if you get too stressed about it, the baby can pick up on that and then produce more cortisol, him or herself, which then makes the baby anxious, and then the baby becomes more fretful. So it's a bit of a vicious circle. Babies also need lots of sleep, and a lot of babies will get very fretful and cry a lot if they're tired. Of course, if you've got a baby who cries a lot but is also unwell, is not feeding well, not putting on weight, vomiting, then of course we wouldn't just going to put that down to colic or that period of purple crying. You need to get that checked out. So some babies who become very unsettled also sometimes have gastroesophageal reflux, or reflux for short, where those babies have acid from their stomach refluxing up into their gullet. Nearly all babies have reflux as a physiological fact, but for some babies it can cause some heartburn and vomiting, and they can get pretty upset, especially when they're lying down or sometimes when they're on the breast. Reflux can be treated, and it's a bit controversial that maybe too many babies do get treated for reflux, but it certainly is a problem that sometimes occurs. Other babies can get upset because of some maternal dietary issues, mostly related to dairy. So, of course, in babies that are formula fed, that's more likely to be a problem, but can also happen with breastfed babies. And it can either be cow's milk protein intolerance or cow's milk protein allergy, and also it can be to lactose allergy, which is the carbohydrate which is in dairy. If a baby has got mucusy blood-streaked stools, then it's often due to cow's milk protein allergy. Or if they have frothy, green, large stools, it can be often due to lactose intolerance. So they're things that can be checked out and can simply be managed by the mother, at least for a period of time, if they're breastfeeding, becoming dairy-free. So the last thing I'd like to say is that basically there's lots of help out there. And so I think my main 4 take-home tips are, first of all, it's important that you look after yourself and be a little bit selfish and make sure that you and the baby have your best shot to have a nice, relaxing and enjoyable start. It's a pity to miss out on the lovely time that's involved with having a young baby. So just take care of yourself. Secondly, get yourself a doctor. Get yourself a doctor that's experienced with young babies, and maybe get a couple and have someone on standby, and ask around, and word of mouth is often a good guide. And often it's a good idea to try before you buy. You're a consumer in the medical world, so it's up to you to sort of find people that are working for you. The third thing I'd say is there are also lots of online resources which can be useful, such as 1-3-Sick. There's the Bringing Up Children government app. Royal Children's Hospital's got great online resources. You should use reputable resources. You can do your head in by kind of just sitting around all night when you're sleep deprived, Dr. Googling. So you should try to use resources that are tried and true, or Nurse on Call if you want to get some advice out of ours. And the last thing I'd say is that you are the advocate for this baby of yours. The baby can't talk and tell you what's going on. So if you've got a concern that things are not going so well with your baby, you are the expert in the mastermind subject of your baby. You're the one who's writing that manual. So if you've got concerns, make sure you chase it up.